Hello, everybody. Welcome to the InTouch Health webinar series. This is Scott Young, and I'll be your host for this webinar. Today, we'll be featuring speakers from InTouch Health as they present on the brand new InTouch Mini. We'll begin the webinar shortly, but first, a few notices. You have all been auto-muted. If not, please make sure to mute yourself. During the webinar, you'll be able to enter questions in the questions widget located on your audience console. Questions will be answered at the conclusion of the presentation, so please feel free to ask your questions at any point throughout the webinar. If a fuller answer is needed or we run out of time, questions will be answered later via email. This webinar will be recorded, and a copy of the recording will be distributed later this week. And this webinar presentation should not exceed 60 minutes, including time for questions and answers. Our presenters today are Shudan Chen, Senior Product Manager, Connected Devices, Gennady Svachenko, Senior Director, Solutions and Product Marketing, and Andre Grigowski, VP Solutions and Product Marketing. And now I'd like to turn it over to Andre.
Scott, thanks so much. We have a nice webinar today for you to introduce our latest solution here at InTouch Health, the InTouch Mini. And the InTouch Mini is more than just a single product. It's actually a host of different variants, and we're gonna walk you through and talk about those. What we're gonna do today is we're gonna talk about those different variants of the InTouch Mini family. We're going to tell you how we've designed the product for consistency across all of those different variants. We're going to tell you a little bit about how those products have been designed for use in different clinical environments. And then we're going to tell you a little bit more about how the product is positioned across all the rest of our products and some of the features and benefits that this new product contains that compares against other products that you might be familiar with that we've developed here at InTouch. And so when we think about the InTouch Mini, when we think about the InTouch Mini, there's really three different versions of the product. It ranges from the InTouch Mini wall-mounted version, which has been designed for small intensive care units or medical surgical rooms. It can be mounted directly on a wall. The InTouch Mini tabletop, which is a portable device that could be carried or set in a position for a longer amount of time, and that could be a great solution for on-demand type consults or follow-up consultations where you want to be able to turn an environment into sort of an ad hoc virtual care space. And then the Mini Cart, which is really ideal, with a smaller footprint for things like behavioral health visits or specialty consults in environments that it would be suitable for. And so now Shudan is going to go through and tell you a little bit more about the consistencies that we've created across the Mini family of variants. And then when she's done, Gennady is going to go very specifically into each one of these products and call out and show you a little bit more about their features and benefits. So Shudan, thank you.
Thank you, Andre. So for many years, the InTouch Health devices have created a telehealth experience where the movement of the head unit mimics the human face and thus allowing for a natural eye-level face-to-face interaction between the remote provider and the local patient as if they share the same space. To achieve that experience, you will see a common design theme throughout the Mini product suite that Andre just went over, consisting of a tablet encased in an articulating head with the integrated audio and video elements that are directed towards the person that the remote provider is looking at, is having a conversation with. So as you think about scaling the telehealth solution across the different clinical programs, of course, many would then have to adapt to the specialty-specific peripherals for those programs used to examine patients, as well as the associated clinical workflows. And so for this product suite, it is equipped and enabled with a built-in Bluetooth and USB 3 ports to allow the connectivity to these modern peripherals. Next slide, please. Thanks. Furthermore, regardless of the clinical program and the care location that you decide to place the Mini products in, we want to make sure that you have a standardized experience for the local clinicians and nurse with a very simple, intuitive touchscreen. So in that way, you could streamline the training of your clinical staff and also streamline the workflow across the different care locations. And some of these interactions outside of a consult session may include things like a network self-check to make sure the device is connected, a feature toggle to display a session duration for billing purposes, perhaps, the ability to preview the local camera so then you know on the patient side what the remote doctor will be looking at, and also on-screen easy access to the manual. And during a session, the local staff can personalize their experience by adjusting volume or perhaps opting only for audio session for privacy reasons.
And Shadon, I would add too that prior to a consult for customers on our solo platform and have purchased our coordinator module, the intuitive touchscreen also facilitates the ability to request a consult from a remote provider.
That is correct. Thank you, Andre, for adding that. So as you can see, the product we have designed is tailored to have a minimalistic presence, both in terms of its footprint for small spaces, but also to have a very slim spatial profile where the technology elements are discreetly positioned and embedded. And that would allow the product to appear unimposing and non-intimidating, because we want the patient to feel safe and open up about their medical symptoms to the remote physician. And oftentimes they may be experiencing telehealth for the very first time. And that way we can create that experience such that the remote physician can precisely diagnose and then prescribe a targeted treatment. And especially for the cart, we really took into account the workplace ergonomics that's really important for the healthcare staff, so that they can easily maneuver the cart around tight corners or even uneven spaces. And furthermore, the product is also optimized for the ergonomics of the patient, so that whether they're seated on a chair, exam table, or on a hospital bed, they will be able to have that eye-level face-to-face consult with the doctor, as you can see in both the provider side screenshot on the bottom left-hand corner and also on the right-hand side showing the patient side experience. Next slide, please. So as mentioned, most of that technology designed was concentrated in this head unit. So to start off, on the far left-hand corner, there's the directional microphone. And also to the right of that is a 10x optical zoom camera, which there's also a 1.9 digital zoom superimposed on there, giving you a total of 19x zoom power. And encapsulated inside this unit is a tablet touchscreen, which has its own battery. But to power some of the other USB elements, such as the optical zoom, the motor mechanics of the head unit, and also the speaker, we've also added a supplementary battery so that in session, the total battery life is approximately close to 2 hours. And then below that, there are two speakers to make sure that the local clinicians and the patient can hear very well. And just to mention, based on customer feedback, the directional microphone has a built-in echo cancellation so that the audio experience on the remote provider side is clear and that they would not be impacted by any noise artifacts. And up on top, you can see that there is a pan joint, which allows for the lateral movement of the head. And also just behind the head unit is a tilt joint, allowing the display to tilt up and down. And this is all controlled by the remote provider through their provider access software. So next, I'm going to turn over to Gennady to go over the specifics of the different variants and how they relate to the different use cases.
Thank you, Shadan. Thank you very much. And thus, more specifically about each variant of the three minis. InTouch Mini card is a new, truly compact and lightweight card that was specifically designed by InTouch for multi-utility purposes to be clinically utilized in a variety of different applications and throughout different locations, from hospitals to specialty clinics, and from surgery center type facilities and procedural rooms to just practitioners' offices. And for that reason, that multifunctionality required to give healthcare providers a unique design. Think new size, think new shape, great mobility of the device to be relocated quickly at first request, and the owners of the device ability to readjust the usage on demand fast and with ease. And therefore, Mini guarantees minimal footprint with a maximum maneuverability for its users, which is a very important feature. Mini reassures unique functions and working at full capacity in the small exam rooms and doctors' offices. But note, not to be taken lightly and to be underestimated because of its size, this is a very much high-end device with HD zoom camera, intuitively turning head, multifunctioning display, enhanced audio system. InTouch Mini card will provide an optimal practitioner to patient clinical experience. And whether it is during initial consultations and first-time exams, patients' repeated treatments, or just post-procedural follow-ups. Lastly, on this slide, Mini card features optional backpack. So what is it, a backpack on the medical equipment? Well, it is a highly functional and frequently in demand, particularly in small rooms and tight quarters, and secure storage for peripherals, small devices, and medical accessories. It is a truly great addition to Mini card. It just provides practitioners with extra functions and helps save time during tight daily workflows. Next slide, please. InTouch Mini wall mounted. Well, this is the next variant of the Mini and slightly different targeted functionality per se here. On the wall telehealth solution, that's what you have here. The wall mounted allows detailed examinations, and I'm putting emphasis here, continuous monitoring of patients in clinics, ICU, critical care units, small hospital rooms. This is a compact, lightweight, and easy to fix on the wall device. It gives providers, which is intensivists, nurses, doctors, the exact the same and familiar perspective of the room and the patient being there in the room. We received actual feedback from many practicing physicians who experienced the use of the device in a test mode, and all confirmed having the natural feeling of physical presence in the room, kind of being able to see the entire room, observe directly the patient, and being able to effectively communicate because of our new audio enhancements featured on this device. The close-up picture on the right shows connectivity ports, AC outlet, USB 3.0, and Ethernet. It also includes base plate. You see that base plate that facilitates fast and easy wall mount fixation. Next slide, please. And the last but not least, InTouch Mini Tabletop. A compact, truly lightweight, and interactive device that can be effortlessly placed on the desk or working table as a multifunction assistant. Once again, multifunctionality and lightweight are emphasized here. It can be moved with ease in place in different offices of the same facility or in between different departments, because carrying heavy, bulky piece of equipment even between offices can be a hassle, especially if it is an urgent medical request or some quick change. So the lightweight feature specifically addresses this here, per se, manual mobility if needed. But overall, the theme that describes it is a multifunctionality and multi-locations with ease of use. It was designed and it is designated to help practitioners with initial scheduling, patient intake, really high quality practitioner to patient audio video consults, and all types of follow-up care. Next slide, Shodan, please, back to you.
Thank you, Gennady. So as you can see, InTouch offers a variety of patient-side solutions, from a WebRTC connection to a standalone viewpoint software download onto your own device, and using a kit to outfit your existing hospital television to create a stationary endpoint, and also a kiosk and console that could be placed in a pharmacy, all the way to the premium solutions, which are tailored to the various care environments. And the Mini in the middle is specifically purpose-built, for the specialty clinic and also the small hospital rooms. Next. Next slide, please.
Yeah, sorry. Looks like it's frozen. Will, you want to try to jump in there? Ah, there we go. Oh, I think it came back.
Thank you. Yeah, that's fine. Thanks. So using the Lite, which is one of the most popular products in the high acuity space where there's an urgent time sensitive use case, I will go over some scenarios where it may make sense where the Mini would actually make sense. And that way, as you're considering the product for different clinical programs, you can make an informed judgment based on the use case and the environment.
Yeah, and just to further extend on that, I think we just want to make sure that everyone is aware we've designed the product to fit many different situations, but not all situations, and that's why we have a large lineup of different solutions. And we just wanted to use the next few minutes to show you some situations where Mini might not be the best experience, but also I think we've talked about already a lot of situations where Mini is a great fit and the different variants are going to provide a fantastic experience. but we just want you to be, we just want to be transparent, and we've done our own sort of mock-up scenarios and testing to see how where the product fits well and where our customers might have some challenges. So Will, if you want to, I think I'm going to need your help clicking the rest of the slides.
Thanks, Andre. So imagine there's a scenario where you have a crowd gathered around the patient area, or there may be instruments and obstacles gathered immediately around the patient. Mini has a fixed height. So if it's placed in the front, right up against the patient, then sure, the remote doctor can see the patient just fine, and the console can go pretty smoothly. However, if it's placed in the back of the crowd, then in that situation, the light or one of the devices that has height adjustability would actually be more advantageous, because it can oversee the crowd and look into the patient area. And for some of our devices, such as the Light Forward Boom and also the Vantage, there is a secondary camera that can offer a different vantage view into the patient area. So this is a situation when you have crowds where it might be better to consider a device that has height adjustability. Next.
Next slide, Will. Thanks.
Now picture a scenario, maybe it's for behavioral health or specialty clinic, where the real estate is very precious and it's very small. So by comparison, looking at the right-hand picture, the light takes up a lot more space, both in terms of footprint and also just in terms of the overall spatial mass compared to the Mini, which is on the right. And so especially when you have a behavioral health patient who's coming in, you want to create a very friendly environment, friendly experience when they can just feel like they're having an intimate conversation with the remote physician. And so in this situation, the Mini wins out because of that minimal footprint in terms of dimension, but also giving the patient a more comfortable experience. Next slide, please. So in this third scenario, similar to the very first one, imagine you have a crowd gathered around the patient, and it's very noisy. They're all collaborating and talking to each other. And so in this situation, the Mini has 2 speakers, whereas a Light or one of the high acuity devices have a stronger speaker system. And so in this scenario, the Mini would probably be better for a private one-on-one conversation with the physician, whereas if you have a situation where it's very busy and people moving around, it might be better to consider one of the more premium products. Okay, next slide, and I'm going to turn it over to Andre.
Yeah, thanks, Shraddhan. Yeah, so I think we so just as a reminder, people, there are a few questions that we'll get to in just a minute, and if you have any more questions, feel free to type them in now. I hope we showed you sort of a lot of different angles and views of the Mini, the different product suite, all they sort of have to offer. We think it really fits. It's going to fit a lot of needs for our customers. And we have additional material. Some of that material is available here through the webinar. You can download through the attachments there. and just to recap some of our content, we have a full product brochure for Mini. We have the Mini comparison guide versus the Lite, and then we have a telehealth devices brochure that we've updated that includes the Mini and the product lineup. And it also goes through a little bit more detail and provides a little bit of specifications and comparisons across the entire product suite. And then you can go to our website under the telehealth devices InTouch Mini and see more information there. There's a great video that shows that Joe DeVivo, our CEO, talks about the creation of Mini and the build out of the product. So lots more content there. And obviously, for those of you, for our customers out there, reaching out to your account executives or your account managers or your InTouch contacts and product specialists, they'll be happy to assist you with more questions as well. But now's a great opportunity to be able to ask us a few questions, as we have the people that have helped design and create the product with us here right now. And so we'll go ahead and jump to Q&A. Will, if you just want to jump to the next slide. And there's a few questions queued up. And so the first question to answer that we have is, if we order the auxiliary video input kit, is there a mounting solution to attach it to the Mini system? Shodan?
Right. If you order the auxiliary input kit for the HDMI cable, there isn't a mounting place. However, you can leverage the tray space on the Mini and also the backpack for storage.
Okay, but it is compatible with it. The auxiliary video input kit is compatible, right?
It is compatible, the standalone version, yes.
And then depending on the variant that they purchased and the scenario, you're saying there would be a way to figure out how to mount it properly?
So if they're using it for the cart, when they're using it, they can set the converter on the tray and also place it in the backpack if they were to get that option. If it's wall mounted, we can help recommend a solution to fasten it next to the wall. And tabletop, they can set next to a table, but there isn't a mounting place on the product itself for the auxiliary kit.
Okay, thank you.
Thank you.
Another question: is the wall-mounted and tabletop model? Are the wall-mounted and tabletop models also wireless enabled?
Yes, they are. They work. All three variants work with Wi-Fi, and it's just the wall-mounted and tabletop, because we expect them to be more stationary, that we also offer the option for Ethernet for places that may not have the best access to Wi-Fi.
Okay, great. So we specifically called out that those two products had wired capabilities because of what you just described. Okay, so all three have wireless. Excellent. Okay, another question here. How many external video inputs are supported? For example, the Lite 4 can have 2 or more auxiliary inputs.
So all three devices, just like many of our purpose-built products, they all support dual view, which is the built-in camera as well as one auxiliary video input. So for the Mini, we would recommend one auxiliary video input at a time.
Yeah, I think the question there was, and maybe the question is, so I think you're saying from the provider side, you can only view one auxiliary input at a time. But I think the question is, could there be multiple feeds connected and you could switch between them, or are you saying you recommend only one connected at a time?
So on the provider side, they can see it in single screen. They can see just the auxiliary video or the video feed from the camera, or they could look at the dual view, right? So that's a feature across Mini and other devices. But in terms of how many video inputs physically to be connected, we recommend one.
Okay. Okay, so here's another question. Does the Mini camera have night vision, like the RP Lite?
The RP Lite, the Lite 4 has an option to integrate a thermal IR camera. The Mini does not have that option right now.
Is there anything different? And so I think the question asking about night vision, I think to be clear, I don't think any of our products have true night vision capabilities. Maybe this is a question more around low light effectiveness and whether or not there's a difference between the ability to view things in low light with a Lite 4 versus a Mini, or are they a similar experience?
They should have the similar experience because the zoom camera on the Mini is the same as the Lite 4. So if they're able to view view the patient's space at nighttime through the Lite 4 camera, then they should be able to with the Mini as well.
Okay, great. There's a question here that says, what are the limitations of ancillary or peripheral usage with the Mini, if any?
So the Mini has USB 3 port, which would be compatible with most USB UVC video scopes, and also USB headset. It also has a Bluetooth, so it would be compatible with the Littmann Bluetooth stethoscope and also the Echo Core version 1, and yet to be released software support for the version 2 stethoscope. And also, if people want to convert HDMI from HD video sources into USB, we have a kit that customers can use to accomplish that as well.
Okay, great. So there's a question here asking, is the Mini replacing the Vici? I think the answer there is we, going forward, we're continuing to support the Vici. We still have some inventory of Vici. We'll support the Vici until its end of life. So I wouldn't say it's replacing the Vici, so to speak, but I think that moving forward, we're not making new Vicis, and Mini will take its spot in the product lineup. Is that fair to say?
Yes.
Okay, and there's a question on who's responsible for installing the wall mount of the Mini. Have we determined that fully, or would we prefer that our customers take that on since it's a facilities type installation in their own facility?
Yes, and we provide the instructions to help them with the installation itself.
Okay, great. So they have an instruction set, and I think as we showed with the base plate, it's as a level on there, pretty straightforward. Put the base plate on there, mount it, and then it just really slips right on. So that's great. Okay, can the Mini control a secondary pan tilt zoom camera like the one found on the TV Pro, like the Telecam?
Yeah, that's possible.
Okay, great. There was a question here kind of a longer question. I'll read it and I'll try to provide a response because I don't want to skip over any questions. So here's the question as written. Given the proliferation of laptop, patient at home telehealth, can this, i.e. Mini, play a role with someone at home, or will that remain a Zoom type solution? Or are there plans to integrate the Mini with a laptop connected to peripheral sensor and diagnostics? And so I think the answer to the question is, our product suite and our capabilities of our platform have solutions to be able to see patients at home. And Mini is not designed, I think, to be a solution that would end up in a patient's home. We have WebRTC based capabilities to, you could a patient at home could use their own device like a phone or a tablet or a laptop to be able to connect with a patient or connect with a provider. So we have those capabilities. This Mini solution is really designed around, care environments like clinics or hospitals or different exam locations where this would be in the environment, and then you can connect your peripherals and other content, and then the patient would presumably be there and show up to be part of that examination, as opposed to the patient being remote. So I hope that helps answering that question. Okay, so it doesn't look like there's any other questions in. I did get a couple of comments saying that we will. Oh, there's another question coming in, but we did get a comment saying that we will continue to concurrently manufacture Vici until the end of this quarter, so through the end of June, and then we'll refurbish used products, but no longer produce new ones. So just a very specific around our future of the Vici there. So thanks for that additional content. Here's an interesting question. Is there any plan for the Mini to come with a boom or a swing arm that would be mountable for like an operating room? Shodan, I know we're not actively working on that, but I'm not sure if that's something we've considered.
Yeah, we're not. We haven't thought about that yet, but that's a good suggestion.
Yeah, I think it's a good suggestion, and definitely something we'd have to consider based off of its weight, right, and its ability, yes, and its footprint and ability to be able to safely hold such an arm. So yeah, so we're not working on it actively, no plans to do it, but I think, as we always like feedback from our customers for use cases. So that's good input. Okay, so I don't see any more questions. We'll give it another couple seconds, see if anybody's in the middle of typing one. And if not, why don't we go ahead and jump to the last slide there, Will, and Scott, you can wrap us up for the day.
Yeah, thank you, everybody. So again, a big shout out and thank you to our presenters for today's presentation. If you have any additional questions or looking for more information about the new InTouch Mini, there's some contact information on the slide now. So we have an email at feedback@intouchhealth.com. And I always encourage you to visit our website to either watch more webinars or learn more about this new device. So thank you, everybody, again, for joining us, and have a great rest of your day.